The human brain is really the last frontier. It has a trillion synapses and a billion neurons. We still don't understand how they're connected to really underlie what makes us human, and that's what drives me to come to work every day.
We talk about in medicine the clinician scientist, someone who's really excellent in clinical work, in this case surgery, and for the sake of Dr. Steinberg, perhaps the most refined levels of neurosurgery. And we talk about individuals who also may do teaching and research. To be honest, it's very hard to do all 3 or 4 of these things. And it's unusual to see someone do them with great accomplishment. But Dr. Steinberg is somebody who has and continues to do that. He is an outstanding surgeon.
My senior year of high school, I was fortunate enough to be accepted into a program at Columbia University for high school students. The course that really captivated my imagination was a course in neurobiology. At that time, there was no such thing as a neuroscientist. This was fascinating to me that you could actually explain animal or human behavior in terms of the cellular physiology and the circuits in the brain. And that's when I really became passionate about studying neuroscience.
Here's a guy who, before he went to medical school, was a classical trumpet player who actually spent a year at an institute in Montreux, Switzerland, testing his ability to play extraordinary music.
When I came to medical school at Stanford, I was admitted into the combined MD-PhD program. What I loved about neurology was the precision with which you can diagnose diseases and also the ability to determine what's the underlying cause. And I also discovered that I really enjoyed the pathology at surgery, seeing the actual surgical field, seeing the organs, seeing how one could repair them when they were diseased or injured. And the other thing I liked about surgery was the fact that you had to make quick decisions. I did my residency at Stanford, but I went away to London, Ontario for a year to study with a real pioneer of cerebrovascular surgery, Charlie Drake. Working with Dr. Drake, my desire and passion for pursuing cerebrovascular disease really crystallized.
You often hear, this isn't brain surgery. Well, brain surgery is what Dr. Steinberg and his colleagues do, and do remarkably well.
Some of the vessels that I sew are less than 1 millimeter in diameter. There's not a lot of room for error, and decisions have to sometimes be made quickly, thoughtfully but quickly. If an aneurysm bursts while you're operating, you have to decide quickly how you're going to handle that before the patient suffers a devastating stroke or worse.
We were operating on an aneurysm, and the aneurysm actually ruptured. That's an incredibly tense moment. There's blood everywhere. There are seconds to be had. And at that moment, the phone rang, and it was actually his daughter. And the nurse is saying, "Your daughter's on the phone. She's wishing you a happy birthday." And he just is operating, "Thank her very much," like no problem whatsoever. And in seconds, everything's done and there's no blood and the aneurysm is clipped and everything is perfect. And I remember telling the story to the chief resident at the time, and they said, "Yeah, that's why we call him the Swami, because it's all magical."
That's a full-time job, to be able to do that. And yet, he has another full-time job that he does in research. His lab and group has done extraordinary research contributions.
Well, he's developed several techniques in clinical neurosurgery and accessing vascular malformations of the brain that hitherto had not been available for treatment. He developed the utilization of hypothermia, low temperatures, in the treatment of vascular malformations to reduce injury from the actual removal of the malformation.
Now, one particular type of stroke from cardiac arrest, is treated by cooling the brain and body. And that's a standard of care now. So we contributed to that outcome in the lab. And that was gratifying to see something that we'd worked on in the lab become a clinical guideline.
He then became focused on stroke and established a stroke center at Stanford, probably the earliest ones in the United States.
He has helped to create the field of stem cell biology as it relates to neurosurgery. He has really been there from the very beginning, before stem cells and human stem cells were part of our almost now regular parlance. He was kind of leading the early days of that.
We were transplanting human stem cells into animal rodent brains, and we could transplant a week after the stroke, and to our surprise we found we could restore function in the mice and rats who had had a stroke. After laying the groundwork in our lab, we began to try to translate that into the clinical arena.
He's shown that several patients now that he has treated in an early phase of this clinical work have had major improvements, so that a patient who was hemiparetic or paralyzed on the right side with loss of speech has regained both. So this is really pioneering work that he is focusing on at this time.
Young medical students really aspire to be, who are aspiring to be a neurosurgeon, look to Dr. Steinberg as one of the world leaders. The individuals who come here are among the most competitive in the field, and that further elevates the entire field of excellence.
He has adopted as a leader, one of his many accomplishments, women in the neurosurgery program. That is extraordinary by comparison with other programs across the United States, as well as ethnic diversity.
Take me, for example, I think at the time, training a woman, training a minority were not popular choices. Obviously, I felt that I was the best, and he endorsed that. His commitment is really to that of excellence. He wants to make sure that he is training the next generation of leaders in neurosurgery.
At Stanford, I'm very proud to say that we train many future leaders. For the past 2 years, 100% of our graduating residents have ended up in academic careers. I'm also proud of the fact that 25% of our residents are women, which is unusual, one of the highest in the country, and we have another 10% of other underrepresented minorities, and almost 25% of our faculty in neurosurgery are women. Again, it's an unprecedented level.
Gary has made major contributions at Stanford in many ways. As a teacher, a leader, one of the outstanding neurosurgeons, vascular neurosurgeons in the world, and then his science is extraordinary. He's increased the role of science in the Department of Neurosurgery, such that now it says reputedly the second most highly funded neurosurgical program for research in the United States.
I think history will be very favorable and sort of endorse that he was by far a noteworthy candidate for this award. And for those of us who've been trained by him, I think without a doubt, he is by far stands as sort of the quintessential neurosurgeon in our mind, somebody who in the theater they say is a triple threat. I think in neurosurgery, I would say I've not met anyone with more sort of a comprehensive packet. He's both a researcher, a clinician, an educator, and his commitment to service and his people are unparalleled. And so I just can't imagine anyone being more qualified for the award.
When you think about leaders in academic medicine, there's a whole gathering of them, and then there's Gary Steinberg. He has made such a major difference for this institution in his now almost 30 years of being here, and just about 20 years of being chair of the Department of Neurosurgery. It's not that Stanford has made Dr. Steinberg great. It's the fact that Dr. Steinberg has helped to make Stanford great.